I'm Simon from the Broadgate Chiropractic space. Today I'm going to be talking to you about the hip flexor stretch, which is very good if you sit for a living. If you're sitting all day, these muscles will tighten up, and if you're getting any kind of groin pain, any hip restriction, and actually low back pain, this is a good stretch to be doing. Today we're going to be doing the hip flexor stretch. Now the hip flexor is the iliopsoas muscle which sits on the front of the spine and in the inlet of the pelvis and then travels down and attaches onto the hip down about here. Now this gets very tight in sedentary jobs where you're sitting all day or driving a lot, and it shortens and gets tight. Now the problem with this is that as it tightens, it can cause an anterior tilt of the pelvis, which increases compression through the lumbar spine. So you can get an increased incidence of low back pain and also hip and groin pain, especially into the anterior thigh. So to do this stretch, you're going to be kneeling down. So if you can just kneel down, put one leg in front of the other. Now when you put the leg in front of the other, you need to be far enough forward so that as you travel over, your knee does not go over your toes, that it stays over the ankle so you're not putting undue pressure on the knee. And then you need to tilt the pelvis up, so you can put one hand on the lower abdomen, the one hand on the lower buttock area with the fingers almost touching the thigh. And then you're going to tilt the pelvis up first before you move anywhere, and then slowly translate forward, making sure that that pelvis doesn't roll forwards. Now you need to be holding this stretch for a good minute on this time, but what you're going to be doing is you're going to be taking the tension to the point of a nice moderate stretch. This shouldn't hurt and it shouldn't be too severe at the start. You're holding it there, and then as it loosens, as it relaxes, you then just slowly ease a little bit further forward. So you can do this a couple of times on each leg, moving from left to right and back again, and just letting it move as it relaxes. So you are encouraging it, but you're not forcing it. You're slowly going forward. The important thing is that you don't lose that pelvic alignment and letting it roll, because as soon as you do that, you're putting more pressure on the lumbar spine again. And as I say, you don't want to be doing this every day, probably evening time after work, but if you're in an acute situation, I would be doing this at least twice a day. And that's the hip flexor stretch.